And right now I just have some chair announcements. We had an executive session on May 29th. And I also just kind of want to recognize the Delaware County Health Department and its wonderful lead-free campaign that I saw bulletin boards and buses and
a little show and tell. This is like one of the billboards that was we had around town.
Yeah, and we just had a Delaware County Lead Coalition meeting today, and so it was great. Everybody's commenting on it, so I just want to give that as a kudos, you guys, well done. And that's it on my chair announcements. At this time, we are allowing public comment on agenda items.
Excuse me, if I could just say one thing, I apologize. When you announce an executive session, you have to say the general topic. So in this case, it would be litigation, I believe. So you can't just say executive, so you say executive session regarding litigation.
Sure. So we had an executive session regarding litigation and other basic health department internal matters. Okay. Thank you. Okay. Seeing no public comment, we'll move on to the approval of the minutes that the board had received from the previous meeting, and I need a motion for approval. Motion approved. Second, third. All in favor? Aye. Any opposed? All right, so the approval of the minutes. And at this time, we're happy to have our director updates from Laura.
Thank you. We're still operating in an environment of pretty significant uncertainty. I have a note about, federal grant update. It was just to reemphasize that there's still so much that's in flux for us, but we're doing the best we can to be resilient and keep planning as best we can. We definitely got a reduction in our immunization grant from the state of Pennsylvania. The amount was about $130,000 less from what we received from them last year for our immunization activities. They are also so uncertain about what the full scope of this year will look like for this, that they've negotiated just a bridge agreement with us. So we, as one of the departments in the county that operates on a fiscal year, our year actually ends June 30th. And so did this agreement. And so the state just gave us a new immunization agreement that just goes from July 1 to September 30th. At that point, they're hoping they'll have a better understanding of the resources available, and then they will negotiate for the following 9 months of the year with all the county community health departments. So that's where that grant is. But on the better news side, I think we talked about the relatively large epidemiological laboratory capacity grant that the DCHD takes advantage of for a lot of our staff support and surveillance support and IT systems. At one point, it seemed like that was going to be in jeopardy as of spending as of March, but that did end up going back to the original funded levels through the end of June. And we just got our fully signed agreement for the entire period of time through this June from the state. I think it was this week. So we're happy that that maintained what we expected to have for at least this current year. We do not know what the next fiscal year will bring for that grant. So that is just, we're going to continue to plan around that. So we are really happy that we submitted our program plan to the state on time. That was due at the end of May. That encompassed all of the activities that we accomplished in 2024, as well as our plans for 2025 and our proposed budget. So you'll see a little bit of that. I'm going to share a couple slides with you guys now. Okay. Sean, can you pull up my slides? Sure. The budget ones. Yep, perfect. Okay, we go ahead to the next slide. We like to reiterate our vision, mission, and values that the board helped us update last year, I think it was. So going, we do think that this budget reflects all of that, important part of our vision and mission. So, next slide. So the fiscal year 25-26 budget that we are putting forth is just shy of $14 million. You can see it's very salary heavy. We've broken out the personnel costs into those first 3 rows, the non-personnel costs in the last row. Again, this is just another way. I'm kind of sharing the information a couple different ways, but breaking out again by salary, by hourly. We have an overtime budget, then the benefits and the recruitment retention line. This is the non-personnel portion of the budget. Again, these are all projected higher than what we actually anticipate, but we do try to build that into our plans. Okay, next slide. This is a breakdown. One of the boxes seems to be not displaying. I'm not sure why, but this is budget by unit. So you can see the breakdown by our major divisions: administration, personal health, environmental health, population health, and that also includes our epidemiology group for the budgetary purposes, and then all other subsidy budget items. And this is by expense. So moving through there. Again, this just keeps like that. Yeah, right. And then revenue. I know that's one that one slightly different kind of take it, where we're getting our incoming funds. Again, this is the maximum amount that we don't spend every penny of every grant that we get. We do the best that we can. So again, this is always the maximum, but you can see how much is federal, state, the state Act 315 funds, the state Act 12 funds, the revenue that's generated from our environmental health program, the county contribution, which is funded through ARPA 100% at this time through this fiscal year. And then we call this the local other fund center that includes funding from the opioid settlement that for DCHD projects, as well as a small amount of Affordable Housing Act funds from our county Office of Housing Community Development that supports some of our lead programming work together. So this is just an overview comparing the budgets that we had in prior years. You can see this is quite a dramatic decrease. We had a vision at the founding of this department to try to project forward with a relatively generous budget to give room for expansion. There was a lot we didn't know about how expensive it was going to be to run a new county health department here. And so we built a budget that had room for that expansion. But as we've learned more about doing the operations that we're doing, we're able to lower that. And we lowered it last year, and we did it again substantially for this year. So you can see there. Yeah. And this is, again, just looking at it, how you can see how we're kind of, there's a lot of different ways that you can work these numbers and what they mean. But this just gives you kind of a picture. Our goal for this year is really to maintain as best we can in this period of uncertainty, relatively level staffing and relatively level expenses and revenue from the prior year. But we will have to adapt as we continue to learn more about where our grant situations are. Thank you.
So is the state pass through of the federal grants? That's the part that we're worried about coming from
Yes.
the state.
I mean,
in addition to unless they decrease their budget for county health departments under Act 315.
I mean, presumably anything could be at risk as the state adapts to the uncertainty that they have as well. But we're not at this time. I guess I can't even say. We're hoping that the straight funds are stable, but I guess I don't know that for sure until it's in hand. So.
Anybody else have any questions? Yeah.
Thank you. All right, and we get to do the new business. I do want to point out that one of the handouts in front of you is the hard copy of the consolidated report. I just was so excited about it this month, and I hope you had a chance to breeze through it. And if not, I thought maybe a hard copy might help. There's really just so much that we've been working on and love to share. So.
Question about the report. I saw that there's an uptick in the the calls regarding closure, just wanted to know what was coming in and how we were able to,
Yeah.
answer the questions.
Yeah, I mean, it definitely went in waves, I think, very early on and right in when the announcement about the bankruptcy and the closures, we got the most calls, I think. And most of it was just, you know, what's happening and what's going to happen to my providers. I think as time went on, it shifted to a lot of questions about medical records and how to still obtain them. With a mix of, you know, how do I find out where my provider is going and if their practice is still open? And we had some, at least one labor, you know, a pregnant woman trying to continue where they could give birth. I think there were several of those. So I think that was kind of, did I miss anything, Gifty, of the flavor of those calls?
Isolated calls about residents and students,
Mhm.
essentially.
Really excited. I don't think, there may not be even in the report because it's so new, but this, or maybe it is, doing these help sessions for seniors to help them sign up to get their medical records through the portals that the bankruptcy court has set up with Kroger. We had our first one today. Some of the people here in the room were part of that. Helped like 21 seniors. It was really positive. Some folks we had actually printed out their records. A lot of them, it was helping them set up the accounts to request their records. It's just, it's a confusing process. Thank you for doing it. If I can talk.
The program.
With some water, it's a warm water that's closed, that's
The
needed.
program plan, have you heard any feedback from the Pennsylvania Department of Health?
We did not get any feedback. Actually, some of my staff asked me that earlier today. When are we gonna get feedback? If it goes by last year, they did not actually give us a lot of feedback until they had all the directors pulled together for an annual meeting in September. So I may not hear much until then.
Okay.
Okay, so we'll move on to presentations. I think the first one up is Dr. Rouland. So the epi one, Sean, would be great to pull up. Yeah, I'm afraid you have to come to the podium so the recording can pick you up. Thank you.
Thank you for the opportunity. Always welcome the opportunity to talk a little about EPI or EPI Group.
Actually, Sean, it might be the other one. That's,
These are the only three that I have.
you don't have an epi one?
It wasn't anything you had.
Oh, no. Okay, I will send it.
My computer.
No, I got it too. Hang on. You can go ahead and, well, do you want to switch? We can do it, switch the order. Why don't we go ahead and have Gifty go first and while
No problem.
we get the presentation to him.
Whatever you like.
We're flexible. Thank you.
Good evening, board. Thank you for having us. I don't need to click, okay. So as Victor gets his, good evening, Gifty Akomiaki, Administrator of Population Health, one of the divisions under DCHD. And I would just present briefly on a few of the programs and a bit of the work that our team has done. Wonderful team it is. We have a few of our members. I have my program manager, Rashida, who really gets it all done. I just make it look easy. So thank you for being here. So as you are aware, the CHIP, which is the Community Health Improvement Plan, was used to assess from residents in the county how we can best address breast cancer awareness. And so one of the priority areas was to prevent chronic disease. And so the goal of that specific priority area was to decrease breast cancer deaths in Delaware County by improving knowledge about increasing access to breast cancer. And so to address that, and as you see in this, out of that CHIP, we received this objective. And so objective 1.1 essentially identified 3 priority ethnic groups that we really wanted to ensure we gathered, that we reached with regard to meeting those objectives. And so Asian females, Black females, and Hispanic females, as you see in the chart, essentially were the high target areas for a group that we wanted to ensure we got their voices. And so we were able to do a bit of that, which I will discuss in the survey that the team was able to launch with the support of the EPI team. In the bottom chart, you will see identifies what was also came out of that CHIP assessment, which was priority areas of Black females, all females essentially, and Black females, primarily from the data that we're seeing with regard to the disparities in breast cancer deaths. And so this image here of one of some of our team members was a partnership that we have with Jefferson to bring breast cancer screening to Delaware County residents. And so the Sidney Kimmel Cancer Center mobile unit, as you see in the image here, has been able to partner with us to provide mammogram screenings to county residents. And so how that goes is they're able to register. There is essentially a number of residents, a certain number of patients that they can see. And so each essentially event is restricted to about 16 people that they can see and screen and then follow up with. And so in 2024, we did partner with them and had 4 screening events. 38 people were screened and 9 required follow-ups. In 2025, our first screening event was in March. We have since collectively had 3 events thus far. Those 2 following events we do not currently have the data for, but for that one event, 13 people were screened and 5 have received follow-ups from those mammogram visits. As you see, the mobile unit, and what we try to ensure is to have the mobile unit in different areas within the county so that we are essentially reaching as many people as we can in collective areas. And the recent 3, we did partner with an agency in Chester, so we were able to ensure that the mammogram was actually in Chester and reached different different community members that we were not able to before. This is a copy of the flyer that was disseminated to the county residents and to everyone to market and to advertise the event. It was in English, additionally in Spanish and Chinese, again, to ensure that we are reaching the target population area that was identified in the CHIP assessment. The survey was open from April 8th up until 5/16. And there were a total of 675 surveys completed. As you can imagine, that is a huge accomplishment because it is often hard to get people to complete surveys unless you're giving something out. They just don't do it, right? There were both copies, physical copies and digital versions were available for completion. And as you see, this is a copy of the flyer. So what were the responses? What was the result of these surveys? 644 females. As I mentioned in the previous slide, there were 675 completed, as we stated, but 644 of them were females. So the other number that is not identified here were either marked the survey as not wanting to identify, or they were males. So just a snapshot of some of the data that was provided by our awesome EPI team. 285 answered that they had a family history of breast cancer. The youngest respondent was 18 years old. 107 answered that they had never, ever had a mammogram screening. 600, which by that alone is a win, a huge success. Right? We reached 107 people who were never able to have a mammogram, but were able to have it because of the partnership that DCHD formed. 659 answered that they had had health insurance. The oldest respondent was 70 plus, and 33 responded that it has been more than 5 years since they've had a mammogram screening. Additional responses that were elicited from the survey: which of the reasons have kept you from going to your yearly breast cancer screening? Check all that apply. As you see, the overwhelming answer, predominant answer is other, meaning that we're not able to determine why. However, the next overwhelming answer is due to time working. So either not being able to have time off of work, not being able, and that could be for a myriad of reasons, whether it's unpaid time or so forth. But that's interesting, and we will utilize many of these answers from the survey for our next steps, which will be focus groups, but I'll speak about that a little towards the end of this presentation. And captured on the right are the zip codes that represent the participants that were captured in the survey. So next steps, for those who answered the survey, approximately 150 shared an interest in joining smaller focus groups. And we want to utilize these focus groups to target essentially why this population are not taking advantage of mammograms and receiving their screening. We are now in the planning stages of developing the questions that we will use to collect this information during the focus groups, and we are identifying willing participants. As you can imagine, it's going to be challenging, but we want to ensure that we have the most robust data collection. And so it is going to take time to ensure that it's a more efficient focus group so that we collect data that's not necessarily captured in the survey that was disseminated. We're aiming for 4 focus groups on our priority population to be completed by the end of this calendar year. And that is the end of our breast cancer presentation. And then we'll go, if you entertain me, we'll speak a bit about our Test and Go kiosk, which we're excited about. I understand that you've heard about our Test and Go before, but there have been changes because we've added 2 new kiosks. So as you are aware from previous reports and previous presentations, we do currently have 3 kiosks, one located at our Yaden Wellness Center on the far right, and the Delaware County Media here, right outside if you came through that entrance, and at Keystone First Wellness Opportunity Center. Those were the free products that when they launched were provided free of charge to all community members. Phase 2, what we did in phase 2 was add STI and HIV testing to these kiosks. So originally when these kiosks were launched, as HIV, STI was not provided, but now it is. So that was phase 2 of our kiosk provisions. And that was added in November 2024 with additional funds from the opioid settlement grant awarded in 2025. Additionally, we have added 2 new kiosks, which are 69th Street, Transportation Center, and Delaware County Community College. And we have found it to be widely successful, as you will see in the upcoming slides. Gun locks were also added. Thank you to the partnership of the DA's office. We were able to add gun locks into all 5 of the kiosks. So the 2 new ones and the additional 3 that have been installed. And this is an overall snapshot. I think this is the older one. Overall snapshot, but I'm going to break it down in the coming slides. But that's an overall snapshot of how all 5 kiosks have performed in the last 8 months, although it's been 9 months now, but I will break that down. So Test and Go for the Government Center, which is the kiosk located here. As you can see, as of April of 2025, there were 1,100, just over 1,100 dispensations. However, as of June 10th, which were a couple of days ago, that did increase to 1,135. The Government Center actually is 35% of all dispensations of our 5 kiosks. And you can see an array of the products and what are found to be more popular when it comes to dispensation. However, the number 1 dispensed product is first aid. For some reason, first aid happens to be very popular here at the Government Center. Number 2 has been condoms, adding in both, because we have 2 sizes of the condoms, and both that is the 2nd most dispensed product, and the 3rd are gun locks. That is an additional snapshot, breakdown by race of the people accessing the products from the government kiosk. There's an overwhelming number of white people, white population accessing products at this center, and then male and so forth for this one. And so that is additional data for the Government Center. And then we move on to the Keystone Wellness Center. As you see above there, 880 as of April, the end of April 2025. But as of most recent, I accessed the dashboard on June 10th, there have been 908 dispensations. So the Keystone Wellness Center is actually 28% of total dispensations of all 5 kiosks. Their number one product are condoms, followed by first aid kits, and followed third is the STI kits. And this is hugely, we find this to be hugely successful as we can surmise, not only because condoms, we are happy to see that condoms, more so than first aid kits, but also because of the direct correlation that it has with chronic diseases, which is assessed in our CHIP. Additionally, we have found Keystone Wellness to be the highest dispense is actually captured by our target, much of our target audience. So as you see, the Keystone Wellness Center kiosk is predominantly accessed by Black African American, which is a target population as identified in our CHIP. Also, women. We also see the highest capture of Hispanic population, Latinos, at the Keystone Wellness kiosk. That's additional data snapshot. According to the our dashboard, Keystone First does have about approximately 55% of the people who are accessing gas do have insurance, but as you see, the other remainder prefer not to say or do not, where we see this to be those who are uninsured are much higher at the Keystone Wellness kiosks that are accessing the products. Then we have the Yaden Wellness Center, which at the time that was 360, as of April of 2025, were 360 dispenses. However, as of June 10th, there have been 403 dispenses, which makes up 12.5% of all dispenses of all 5 kiosks. The number one products are condoms, followed by first aid kits, and then STI, HIV kits. And we have found, while there have been several dispenses of STI, so if I didn't explain it earlier, you can access an STI HIV kit, take it home, perform a self assessment, self-test, and then return it back to the kiosk, at which point it will alert the company, and they will pick up the specimen immediately and contact the individual, the results. Individuals can also return it with a self-labeled to the FedEx and have their results also returned to them. So we are finding the last, my Access dashboard, we've had approximately 45 returned tests from the STI HIV kits, which again is certainly addressing the concerns of chronic diseases. Also, as you can see in this graph, Black and African American are an overwhelming majority with regard to race accessing our products in the Yaden Wellness Center.
That one, yeah. Different gender profiles.
Yep. And then our most notable, and I say notable because while this is our newer kiosk, which is only recently installed in the fall, it has overwhelmingly been the most accessible and the most popular of all 5 kiosks. And we're really excited about that because DCHD initially did want to launch in 69th Street, but was unable to. And so being able to launch and place a kiosk there in this second phase has been has met our goals and desires. It has proven to be very successful. So for only a few months, as you see, as of the end of April, there were 507 dispenses, but as of 2 days ago, there were 593 dispenses for a kiosk that was only launched in April, right? April. As of now, it is 18% of all dispenses of all 5 kiosks. And the number one products for the 69th Street terminal, again, are condoms, followed by blankets, followed by first aid kits, and fourth, STI HIV kits. As you can see here, again, there is definitely a difference in race and gender that we are seeing in comparison to those who are accessing it at the government center, in comparison to those accessing it at 69th Street. We are meeting, again, the target population, Black, African American. And then there is a certainly a myriad of other races that we are able to reach with this kiosk at 69th Street. Medical insurance for those when asked, as you know, they're on the dashboard for the kiosk. It asks you these questions. The constituents are able to complete it or not, but 32% are prefer not to say whether they have medical insurance, but 36% of those who have accessed it do not have health insurance, and so are accessing our products because perhaps are unable to. And lastly, of our kiosks is DCCC, Delaware County Community College. As of April 30th, you see here, we're 146 dispenses. However, as of 2 days ago, that has increased to 200. Surprisingly, which surprised many of us, the number one popular products. This was a little different from the rest of them, as you see. While first aid kits, again, seems to be quite popular, this kiosk, different from others, seems to be heavily also popular with the gun locks that we partnered with. And surprisingly, additionally to that data, it's overwhelmingly 18 to 24-year-olds who are accessing the gun locks at DCCC. And so, again, you see the breakdown of races and gender. As you see here, regarding the age, overwhelming number of 18 to 24-year-olds, as can be expected because it is a college. And yes, the majority do have health insurance, but again, we see here that we are still reaching those who do not have health insurance. And that is it for my presentation on breast cancer and the testing go. Any questions? Darn. Yes, yes.
They have to input in, and if they don't put in the information, can they still get the product?
Absolutely. So what we're trying to gather is just demographics on race, on age, on gender, general demographics that will not give identification of who the individual is. We certainly do not want to deter anyone from accessing the kiosk or feeling any bit of slight or stigma. So they do have to put that in. However, do you have to put it in to access the products? No, you do not. So you can bypass it and still access the products. Except for the laboratory tests like the COVID and the STI, HIV. As you can understand, you would need to be contacted for your results. So with that one, they do have to input their information, but that is the information that they put, the identifying information goes directly to clinical staff. And so it is not accessible by all of DCHD, but the clinical staff as well as the state.
STI testing, is that the kit when they return it, you put the information, or is it you put information in the kiosk?
You can, you have to put in some information to get the kit to come down.
Okay.
But you can also set up a portal for your results to be mailed to you after you take the kit with you, so.
Personal information. Yes.
That's good work. Thank you. Tremendous work.
Thank you. Thank you. Thank you for the support to do the good work.
Okay. I was curious, I was struck by the number, the percent of follow-up for the breast cancer screening. In the most recent one, it was like 5 out of 13 people needed follow-up. And I was curious what that follow-up looked like for them. Okay.
Yep, sure. Come up here. Come up here. This is Williamson.
Sorry to make
Just
you-
talking about. Again, the partnership with Jefferson allows for the contact to come directly from them as they're the ones that are performing the screening. But I'll speak.
And so when we created the partnership, we did ask them if they were to find something in the imaging, what will be the next step? So they did ensure us that they will be responsible for following up with all the patients, scheduling them, assisting with transportation if needed, because they are coming to Delaware County to work with these patients. So they do have to get to Jefferson, which their main campus is in Philadelphia. You don't need insurance for this. So if you do not have insurance, they also cover that as well.
Thank you.
You're welcome.
Question about the mammogram screening. I noticed that you had that survey, the 18-year-old, assuming an 18-year-old came up to get a mammogram screening. Would you ever turn them away because of age?
Yes, so for the program, you have to be 40 and older to get a screening. And the survey was not we didn't pass out physical copies at the mammogram event. This went out via links and QR codes and digitally. So an 18-year-old got the survey and they took it. Yes.
I thought they would actually came in, went to the event.
No, that was just for the screenings, yeah. The survey was distributed wide.
Any other questions?
So just looking at this, it seems that most people have health insurance. Do we know why? Is that right? Is that statement accurate?
Which one?
For which one?
For the breast cancer?
Yeah, on the breast cancer, on the slide that you had up on the screen, 659 answered that they had health insurance. How many screenings were done in total?
So these are the screenings. This is the survey. So the survey, we did 675.
How many mammograms were done total?
Separate.
36 and.
Yes, 36 and 5, yes. So those insurance, non-insurance numbers would be different.
Okay. Where was this survey administered?
It was offered digitally, so it went out via our website, via social media, and then we also have physical copies that we partner with some of our CHIP committee members to send out digitally and also have physical copies.
And I have a question about the kiosks. Are they meeting your expectations in terms of the dispensations, or did you expect more or less, or just curious? I know it's sort of a subjective question.
Good question. I would say they are more so happy to. There was, unfortunately, we did question essentially the data that we were receiving from the government center, because you never really know if they're employees, if they are jurors, if they're constituents. So that is a little skewed,
Yeah.
right? But 69th Street, I think that's more representative of who we're trying to reach, because it is such a highly traveled area, very transient area. And so we wanted to essentially capture those who are not necessarily county employees, but and in different races and ethnicities.
But we had the data that allowed us to see the zip codes of the folks that were being served at every location if they provided it, including at government center. And I think we're pleasantly surprised at the breadth of zip codes that were represented. So I mean, we don't know, you're right, if they're employees or not, but yeah.
And I will say the Gaydon one, so we know that the highest utilization is after hours, and that was a goal of ours because our clinic does close at 4:30. So we wanted 24-hour access, and people tend to use the kiosk more when the clinic is closed, which for reasons why they might not want to walk in the clinic and talk to us, or they might want to get an STI test or COVID test and don't, want to have the conversation about it. So I would say that one is definitely meeting its needs. Even though it's a little low, it is doing what we wanted it to do.
I don't think we set numerical goals. I think we've been very pleased, and some things have definitely exceeded what we thought would happen this soon. So,
And I think as more people know about it, the numbers are gonna go up.
I would think,
Yeah.
we can keep supporting it.
Yeah, like,
Yeah.
And it's great to see a range, because we're seeing a huge range in age and races. And so we know that we're meeting people, at least getting the range of people that we want to, constituents.
Is there any opportunity to have a more targeted distribution? And what I'm getting at is that it was pretty consistent that condoms were, in greatest demand across all of the kiosks. Could you have smaller kiosks in more places that might be less expensive and reach more of the population? Is that
Offer condoms by mail, so those are the only way to get them, and we distribute them a lot in person. You're right, you could have a different kind of program that really appreciated the fact that this allowed this testing component that was very different, and we felt met a need that was pretty unique. So.
And And it was exciting to, in looking at just maybe other areas and other states that have taken part in the kiosk offers. They generally tend to offer harm reduction kits, so essentially one type of public health product. And so it was exciting to be one of the first to offer an array of public health products and just offer that range. And so that is different in comparison to other areas, but it is, we will monitor how accessible those products are and maybe have the conversations of perhaps reducing it, but you just never know. There was no way of knowing when the gun locks were offered that it would be that popular.
That's striking.
Right?
Striking.
It is. And where, right? At the college. So I guess you just never know. There's also been conversations about seasonal with the blankets. We do see higher access of the blankets. While I think some people are not really understanding what type of blankets they are because they're the Mylar blankets, not necessarily a warm fuzzy blanket, but we suspect that may decrease during the summer months. So it is important to essentially wait, I guess, a full calendar year to see how seasonal impacts the access of the products.
Yeah, and I think a lot of times, particularly like the Keystone and the 69th Street, that's a lot of homeless populations in
Right.
those areas. And so I think you're gonna, it doesn't surprise me that the first aid kit and the blankets are popular at Keystone and Upper Darby because of the populations there.
We were excited when we saw the first harm reduction kit dispensed at 69th Street, right? Just being mindful of safety. So
Yeah.
that was exciting to see that while it's not as high as the other products that we've talked about, they still have been accessed, and that alone is a win.
Great.
Have you thought about pregnancy test?
We
Yes.
have, we have, we certainly.
And Keystone First, actually, so they're one of our partners and they're a great partner. Oh, yes. They were the ones to kind of bring it up too.
Yeah.
So our supplies do come from grant funds, and some of our grant funds are just tied to certain things of what we can purchase with them. So we will not stop exploring the opportunity, but right now we're kind of still limited to what we can put in the kiosk.
Any other questions?
I think I better actually shut it off because we're on a.
I know, right? Thank you, though. Great questions. Thank you for the time.
Sean, if you don't mind zooming to the end of where we get to the lead portion of this presentation.
Yep, that's
I'm
yours.
just gonna very quickly,
You want me to click you for?
yeah, you
Okay. Okay.
zoom through this. Right here, like for example, Rose, thank you for opening up and commenting on this campaign. We'll have even more to share, at the end of the year, but we wanted to at least show you the digital campaign results. They were shared with us this week, and I'm like, I just have to give these to you. We had, 800,000 impressions, 7.8 thousand clicks. These all exceeded the benchmarks that this experienced company that we're working with suggested were going to be achievable with this campaign. And we went above on images, stories, videos, and YouTube. And we're just so excited to see this level of interest in what we were sharing to increase awareness about lead. Yeah, this is examples of all the partners that we work with. Keep going. These are the municipalities that we talked with and distributed materials with. Here's, we specifically developed partnerships with birthing facilities and practitioners listed here. These are all the daycares that we went to and shared informations with. You can see the different languages we were also able to distribute when we're doing this with early intervention locations in the DCIU, elementary schools, faith-based organizations, hardware stores. We're just so grateful for the folks that we're working with us here. Grocery stores, libraries, definitely some individual pediatric practices, and some pre-K schools, YMCAs, community partners. We just want to give you the flavor. We work with all these legislative contacts. We mentioned our community health improvement plan and our CHIP partners. So I just want to give you a flavor. When we really go all out trying to get some messaging out, this is how we do it. And we learned so much from this process and developed so many relationships that we hope to continue to build on. All right, so now Victor's turn. Thank you for being so patient. And I'm so sorry, Sean, that I can see what I did wrong when I sent you the files earlier today. So hopefully it made it through. Oh, yay. So Victor, you'll still have to come all the way to the front.
was being like, what's that?
Oh, it never made it through on the email. Oh.
It's,
Okay, great. All right, Victor.
He's done it before.
Yeah.
Here we are again.
Here you are again.
Take two. So let me see if I can. I don't need that. I don't need that. So again, good evening again, and thank you, Laura, for allowing us to present on behalf of our team. What I'm going to talk about this update is about a couple of things briefly. What we do, and then we're going to go into the leading causes of death in Delaware County. And then we're going to go into the leading causes of death by municipality. And we're going to also talk about reportable diseases, sexually transmitted infections, the leading ones, and that will be it.
All in 10 minutes.
Yes, or maybe less. Let me see if this is working. Oh, it is working. Okay. So this is what I put together. These are not all the things that we do, but these are the big ones. And if you look at this chart, we're mostly concerned with looking into patterns of diseases. Is it higher this week compared to the same week last year? We're looking into causes, viruses, bacteria, lack of access to prenatal care. And we're looking at the distribution of diseases in populations. How many individuals having a disease? Where do they live? Who they are? What are their ages? And all of this is trying to answer the question why this is happening. And the other thing is, what can we possibly do to change this? Everything has been improving since the 1900s in the United States and the world, but still there are many, many discrepancies in terms of who is experiencing some diseases. Some of the work that we do involves affiliations, outreach, presentations, and we do that with pleasure. We are happily working with different health committees, NAACP is one, the city of Chester is another one. We have affiliations with academia, with nonprofits, government agencies within the county, and that helps us to do a lot of things. One thing that I forgot to mention is that the other thing that we do a lot is the needs assessment, but that helps us only also to provide the language and the justification to write grants. And we have been able to do that for the last number of months, well, since I got here. So this is something that we're very proud of. Let's look at the leading causes of death. And here we're looking at all races, leading causes of death, Delaware County, the whole county, from 2019 to 2023. As you can tell, you have a column which counts the number of deaths, all races, all ages, all sexes, and then the age-adjusted rate. Now, when we look at a rate, I think this is a powerful tool. The numbers is very important. How many people are being affected by a disease? Thousands, 50? Then the rate tells you something about the risk. For example, if we have 50 out of 1,000 with this specific disease, and then another population with not 50, but 200 out of 1,000, that is telling something about that population, the risk of that population. So that is the crude rate. Age-adjusted rate goes a step further by adjusting for the effect of old age. As we get older, we are more likely to experience some diseases and death. So this is why I included age-adjusted rates. So you can see heart disease, cancer as being the leading ones in ranking, but when you look at number 10, the one in red, uh, cerebrovascular, that means blood vessels of the brain, stroke, we are the 10th leading causes of death in Delaware County, but it's red because it is significantly higher compared to Pennsylvania, to all other counties. So that is something to think about. The other ones that you see highlighted in blue, good news. We are significantly lower compared to Pennsylvania. However, we'll still have the problem. So that the leading causes of death by race, and what I wanted to show you here is that it differs. This is ranking again, the number one sorted out. And then if you look at Asian populations, the 15th or 13th cause of death is diabetes. However, diabetes death is not among the top 20 for Black or white populations. So this shows you how it is different. Again, the shades of blue lower than Pennsylvania as a whole, pinkish or reddish higher Delaware County compared to Pennsylvania. Now, let's look at municipalities. Yep, that is the one. I look at municipalities for the major causes of death, cancer and heart disease. And then in terms of municipalities, high to low, this is only 2023. Upper Darby, the largest number of individuals dying from cancer in that year, followed by Haverford Township. When you look at the other column, heart disease, Upper Darby with a higher number of individuals dying for heart disease, and Haverford Township second, and so forth in ranking order. Look at the lower chart, and this is not numbers, but rate. And now you're going to see that the rate of cancer death is higher where? In Ridley Township, second by Thornbury Township. This is for the year 2023. The highest death rate, crude death rate for heart disease, Ridley Township again. This is an information that we take from these numbers, and then we develop conversations about what we can do with this type of information and data. So that's very telling. Keep in mind, Ridley Township, higher death rate, cancer and heart disease. That's what's happening here now. This is a very beautiful and elegant exercise. Here I calculated by hand, not with artificial intelligence or anything like that, age-adjusted mortality of about what? Ridley Township versus Delaware County. And what years? 2019 to 2023. Age-adjusted, so we are adjusting for age. So who was higher in the age-adjusted mortality rate? Ridley Township higher than Delaware County as a whole. I again use another different type of calculation. It's called the standardized mortality ratio. And again, Ridley Township came ahead of Delaware County. So we compare using two different methodologies, the age-adjusted mortality for Ridley Township versus Delaware County. And this is for heart disease. This is not for cancer. So that is very telling. Let's move at reportable diseases. Top 20, and I summarized top 20 because the list is very long, but the top 20 leading reportable diseases, Delaware County, when? The first quarter of 2025. And you have a list of the diseases in ranking order by number, and then on the other columns, you see the comparison of year-to-date between Delaware County and Pennsylvania. Those highlighted in pinkish color means that they are significant, that we are higher than Pennsylvania, higher than Pennsylvania. And we have here at one of the top leading causes of reportable diseases, chlamydia, gonorrhea, hepatitis C, Lyme disease, hepatitis B virus, and syphilis. So those are the ones that are the top leading reportable diseases first quarter 2025. This is protected data. And I also showing here the flu A, flu B, and RSV, and we can see that we also quite different in terms of Pennsylvania, Delaware County. Let me see, what is the other one? Why is this thing not more? Oh, I know why. All righty, so what I did here is just a note, maybe the public can use this too. What can we do about this? Well, to prevent these chronic diseases, this is by the CDC, of course. We talk about smoking as a big problem, food, of course, the balanced diet, vegetables, fruits and vegetables and so forth, a diet moderate not so much high in or low in some things, but to make people think, what are we eating? What can we change to improve our health? And we're looking at foods with low saturated fats, good fats, but also not added sugars and things like that. And of course, sodium. Movement, physical activity, alcohol consumption, screening for breast cancer, colorectal cancer, and lung cancer early, rest, very important, family history, and so forth. For STI, and to conclude, we're recommending, CDC recommends basic, getting vaccinated, and things like that, regular testing, and using condoms. This just highlights of many recommendations people have been trying to do, and this is our way of trying to improve the health of the community. But again, all of this would not be possible without your support, the support from leadership, from the council. It's making our jobs much, much easier. Thank you very much. I hope you have any questions. You're very kind. Any questions?
Do you feel like in Ridley Township, it must be something environmental? Like that the list that you have is really important, but it's just because of the cancer risk and the heart disease risk, it seems to me that there might be something that we might want to look into further.
That is a very good point. By the way, we're also looking into air emissions by municipality close to emission plants. So I will definitely take that advice, because we are going to, I will take a look at Ridley Township, how close. Memory, and let me tell,
I mean, this is the real
yeah,
terrible conundrum of trying to understand the causal links behind cancers, and very few cancers we know for sure have a bona fide environmental exposure link. But this is the kind of data that wants us to ask more questions.
yes.
And if there are any things that we can do to help in terms of, mitigating what seems to be a higher risk
Or
there. we'd
maybe
like
meet
to-
with the community and find out what they're saying or why.
Yeah, it's a very-
It's
very
like
complicated
something I
question.
think worth digging into,
Mhm.
because it's substantially, at least to me, it looks that way. I don't know if anybody else.
Now, I will also do an age adjusted for Ridley Township for cancer. This one that I did is for heart disease, because it's the leading cause of death. But definitely I will take a look at this. Very, very good question. Thank you very much, Rose.
Diabetes didn't show up among the top causes of mortality, right? But diabetics die of heart disease and strokes and so on. Do you have other measures of diabetes morbidity that might be informative for our interventions? I mean, hospitalizations, amputations, those blindness, kidney failure, those sorts of measures.
Yes, we have been partnering with the City of Chester, the Health Commission. And they have been able to collect data of amputations. And definitely they share the data with us. I will look into this also. Diabetes as a leading cause of death was not on the top 20 for Black and white. However, it was number 13 for Asians. That is. And then if you look at the analysis again, I believe the third cause of death among Asians was cancer. So not different. However, for the other groups, Black and white was related to heart disease and not cancer. So there are differences that we need to try to understand better. And again, the purpose of these numbers is to bring some questions and begin to look deeper. The other day, I was looking at a report published by the Pennsylvania Department of Health about infant mortality. And they cited 29.9 infant mortality rates for the city of Chester for every 1,000 births. And I said, wow, that looks strange. I began to look at their own data, and I found a huge discrepancy. I alerted them, and they said, yeah, it is not 29, it's 18.1. And they're going to fix the report. But that tells us that we need to look at these numbers with caution before we use these numbers to inform policy. Take the numbers and then see if we can find the same results from different sources. But I will look into this because we have a lot, and diabetes, by the way, is prevention. It is my passion. That's what I did my thesis, primary prevention of diabetes. So I will look into that. Thank you. All righty. Thank you. Thank you, Sean.
Want to check, Odie, I know you're online. Did you have any questions?
No, Rose, no questions.
Thank you. Anything else from the board? I don't have anything else.
No.
Anything else? Okay, I don't think we have to ask for a public comment, but I'll ask again. And seeing no public comment, I'm going to call for adjournment. So we just need a motion for that.
So moved.
All right, second, favor?
Aye.
Aye. And I'll just say that our next meeting is September 25th here at the County Council Chambers once again. So thank you all for coming. Thank you all to everybody from the Health Department coming out for a little later tonight and giving us these great reports. Thanks, Laura, for everything. Taking great notes. Sean, thanks for everything you're done. You're awesome. And